Right, well, good morning, everybody, and welcome to this TBI Talks seminar, our first webinar of the lockdown. So if we have technological problems, it may be user error or it may be technological error, but hopefully we'll be okay. And we're here today to discuss exit strategies from the lockdown. Now, we know that just over 3 weeks ago, the UK government followed many other European countries in putting in place some very stringent lockdown measures to contain the spread of COVID-19. And it's becoming rapidly clear that the economic consequences of that lockdown are very severe, with the OBR suggesting that if these lockdown measures went on for 3 more months, then we could be seeing an impact on the economy of perhaps a third, a reduction in economic activity of around a third. But there's also other health consequences and education consequences too of the lockdown, which means that it comes at a very significant cost. So once we're past the peak of the virus, it will be important to have a clear direction of travel for the policy and for the exit strategy from current constraints. Now, the exit route out of lockdown could involve any number of policy measures. It could involve letting some sectors of the economy be released first, or some kinds of workers. It could involve use of masks or intrusive testing and tracking. And whatever it looks like, really, that strategy will require a lot of preparation by government, and it will also require the government to take the public with it. On what could be some reasonably controversial measures. And so that's the sort of focus of our discussion today. And we're really kind of trying to get at 3 questions. What does the exit route look like for the UK, or what should it look like? What are the practical and political challenges of achieving it? And what can we learn from other countries that are perhaps further along with some of the elements of an exit strategy already in place? It's a multifaceted topic. It covers epidemiology, it covers health, technology, politics, economics, communications. And so that's why we've got a very broad and experienced panel to hear from today to kick us off. We'll hear first from Professor Andrea Crisanti, who is Professor of Molecular Parasitology at the University of Padua, if I pronounce that right.
Actually, no, I'm Professor of Molecular Parasitology at Imperial College, and I went on sabbatical to Padua.
Ah, okay.
Professor of Microbiology.
And many of you will have probably read some of Professor Crisanti's work, particularly in the city of Vaud, which looked at was about the first study to discover the rate of asymptomatic spreading of the disease. We'll also hear from Sonia Sodha, who is a Guardian columnist and the chief lead writer at The Observer. We'll then go to Aaron Maniam, who we're delighted to have from, he is the Deputy Secretary of the Ministry of Communications in Singapore. And as many of you will know, Singapore have been ahead of the game with their contact tracing app. And then finally, we'll hear from Bronwen Maddox, who is the Director of the Institute for Government. So with that, I will hand over to our first speaker, Professor Crisanti. Interested to hear what you had to say. Thanks.
Okay, so first of all, I will give you a first idea of what's happening in Italy now. We see a progressive decrease of people admitted to hospital. We see a significant and progressive decrease of people admitted to resuscitation units and intensive care. So this is a very good sign, but we still see an increase of cases on day-to-day of about 2,000 to 300,000 cases every day. But this is not the real incidence of the disease. So this is a big problem, because the number of cases per day somehow provide a proxy to understand the risk of lifting all this social distancing measure. And there is increased recognition that we need to do something to have a better vision on the real incidence and stratify by region and also by different class of people. And this is still an unsolved issue. But nevertheless, there is a huge pressure from different economic sector to reopen or to lift some of this social distancing. So what is happening now in Italy is that some of this social distancing are progressively lifted, and to minimize the risk of transmission, the authorities have implemented some measure like compulsory mask and compulsory disposable gloves. And they are thinking about implementing some contact tracing application, although this is still up on the air in terms of discussion, because you need a special law in order to limit your right of privacy. So this is something that probably will happen in the next 4 or 5 weeks. Meanwhile, we are increasing our capability to do swabs, particularly in the Northeast region, because we believe that this is an important tool to have a clear understanding of the incidence of disease. But at the same time, we believe that this is an important tool to address the new start of the epidemics in cluster, if you want. So we believe that this lifting of social distancing, it will be associated inevitably with this, with an increase of transmission in some area. So we need to develop the capability to, in principle, to address this cluster and eliminate them as we did in VO. So in principle, the idea is that a cluster appears, we need to have the capability to test, to lock down a borough or to lock down a small village, and then test everybody and put everybody who is tested positive in isolation, come back the second time after 9 days and do the same, and then eventually you clear up the entire area. This has proven extremely effective because in VO, after 6, 7 weeks, we haven't seen a new case. So we know that this strategy works, but you have to build the capability to repeat what we have done in VO, because it is effective, but it requires some logistic and some capability, and also requires some the ability to intervene there aggressively and rapidly. So we are building this capability. Now we are also started a screening of all elderly home, both host and staff, because we believe that these are very vulnerable people, and could be also, we have seen there is a source of a new transmission. So we are looking at this situation. We are also trying to test all hospital staff, because again, hospitals are a source of transmission. So we're although in Italy, let's say, we have not reached a situation where we have transmission, zero transmission, we are trying to, let's say, lifting some of this restriction while addressing some source of transmission. This is what we are doing at the moment. Now, this is, of course, is a. I know I'm reading your document is a kind of stop and go, because transmission is not really completely blocked, but in a way, the Italian government doesn't believe that we can afford another 3 or 4 months of lockdown without creating irreversible damage to the economy. So they believe that this is a risk worth taking at this moment. So in principle, this is more or less, I mean, if you have additional questions, maybe I'm happy to address some more specific. I hope I stay within the limit.
Thanks very much, Professor Crisanti. I mean, Andrea, maybe if I can ask you first, just cut off the back of what you said there, it sounds very much as though the strategy that you advocate depends on having the number of cases already very low so that you can really swoop in and close down clusters as they spread. The number of cases, daily cases, is still pretty high in Italy. Does that mean that the strategy that you think will work is still some way off being viable?
Well, I think it probably to lift all the social distancing measure at this point is premature, and in fact it's not happening. What they're doing, they're allowing some some small shops and activity to open 1 and 2 days per week. They allow some key production facility to run with decreased staff. So it's, I would say, it's very, very preliminary what is happening in Italy. You should also consider that the spread of the infection in Italy is not uniform. We have a huge problem in Lombardy, and we have very low transmission in southern Italy. And also in Veneto, we have relatively low transmission. Just to give you an idea, for example, in Padua, yesterday we have only 32 new cases on a population of 1 million. So in principle, you could start thinking of doing something there.
Yeah. So some kind of geographic approach is possible.
Yeah, exactly. I think it's, and now there is a lot of excitement about this serological test, which actually I do not share, because we have seen that they have a lot of problems. Definitely they are not good for diagnosis. Definitely they are not good for inferring any immunity status. Probably they are good for epidemiological analysis, just to have an idea how much the virus has spread in the past. But this is useful because it can help you in focus further action or further surveillance in some area that have been, where the virus has spread very much. So in principle, for example, if you find a city or an area where you have, I don't know, maybe 40–50% of people that are positive, maybe there is the right place to do some sampling with swabs and understanding how many cases still active are, which are either have very few symptoms or no symptoms at all. So I think serological studies would be very useful, but I don't think they find they would be used for diagnosis for IgM or for providing a kind of immune certification. So I don't think that this is the way they should be used.
Great. Okay, now I'm sure that people have a lot of questions about the situation in Italy, but let's go to the UK. And Sonia, do you want to pick it up from there and give us your take?
You're on. Good.
Yeah.
Okay, well, thanks very much, Ian. Thanks for inviting me to take part in this discussion. I think we all got invited to take part last week, and it felt timely then. It feels even timelier now, as I think the focus on the political debate in the UK has very much shifted to exit strategy. I feel like I should preface my remarks just by saying that I'm obviously not an epidemiologist or a virologist. I'm an observer of British politics and economics, so everything that I say should be taken with that sort of context in mind. Yeah, so as I was saying, it really does feel like the political debate has shifted to exit strategy in the last few days. And not even really what form the exit strategy should take, but really whether we should even be talking about it. And that feels very politically contested at the moment. So on the one hand, we have the government. Many of us might have heard Matt Hancock on the Today programme this morning saying it would be wrong to even talk about strategy for exit right now, just when the clear government message is still, you must stay at home. And then on the other hand, you've got the opposition, Keir Starmer, the newly elected leader of the Labour Party, very much pushing, holding the government to account on exit strategy. It seems to be the main thrust coming from the Labour Party at the moment. And in the government's corner, you can see why they may be worried that diluting that stay-at-home message might undermine some of the excellent behavioural response that we've seen from the public so far. I think it's important to note that I don't think anyone forecasts these levels of public support for the lockdown. They're incredibly high when you look in polling. Also, if you look at what's actually happening in the country, people really do seem to be taking social distancing very seriously. But we know that that could change quite quickly. And I mean, I think behavioural science is really kind of educated guesstimates at the moment, because this is so unprecedented. But there certainly are some people who seem to be worried that if we turn the curve and if we see infection and death rates start to fall, which is obviously what we're all really hoping for, there may be a bit of sort of public thinking, well, did we all overreact here, and not taking social distancing seriously. So you can see where the government is coming from that perspective. But I think the real concern from the opposition, and certainly from me as a journalist and an observer of this, is the concern that actually we're not talking about exit strategy at all. I think it could be packaged quite carefully so it doesn't distract from the messaging to stay at home. And really, I think there is a bit of a sense that the reason why we're not talking about it is because the planning isn't happening that we need to see in government. And I think actually, if I were the government, in terms of dilution of message, I would be far more worried about some of the anonymous briefing that's being done by some in government, whether that's ministers or special advisors. We saw going to the Easter holiday weekend last weekend, anonymous briefing by people saying that actually, that from government, saying that they thought that the public had been too obedient, which I think is not the message to be sending going into bank holiday weekend. We've just seen in the FT overnight briefing about potentially relaxing restrictions for in time for the 75th anniversary of VE Day. This is not helpful. That's what the government should be really worried about, rather than a mature, open and transparent discussion about exit strategy. And I think Keir Starmer is right that talking about exit strategy doesn't have to be specific dates. It's being transparent about your planning and about the potential triggers that might see a relaxing of social distancing restrictions. And I think, you know, as Professor Andrea was just saying, that's, you know, that may well be infection rates, for example. So what sort of infection rate, transmission rate would we be looking for before we start to see a relaxing in restrictions? And I think the reason why it is so important that there is a level of scrutiny about this is that the government's track record to date has been quite mixed and patchy. So I think if you look at some areas of its pandemic response, it's been really exceptional, actually. So if you look, for example, at efforts to increase critical care capacity, I think that has exceeded expectations. Sort of 4 weeks ago, we were talking about the NHS sort of facing a tsunami of cases that would totally sort of bowl it over in terms of critical care capacity. That hasn't happened. But then I think in other areas, the government response has been far, far more problematic. So in terms of kind of ventilator procurement, in terms of procuring extra testing capacity, in terms of procuring and distributing personal protective equipment, we know there have been huge problems in there over a period of weeks, and that the government has not used the time that it had in terms of the warnings it was getting from Italy, for example, in the same way that other governments like Germany have. And that is so important, I think, because whatever type of exit strategy you're looking towards, there's one thing in common, and it's planning and absolute kind of government capacity to take strategic decisions, to work with the private sector, to get things going weeks in advance. And we know that this government hasn't done that in some really important areas. And so I think concerns about whether that's happening right now for an exit strategy in a few weeks' time are absolutely legitimate. And the opposition is clearly right to be asking questions about that. And there were briefings in The Guardian as well today from Whitehall sources saying that that central coordination is just not happening at the moment. So I think that there's a really important question, which I'm sure Bronwen will talk to, which is about how do you organise government in order to make sure that this is happening. But I think in terms of the sort of different exit strategies that are available, planning is important to all. So obviously a vaccine is the ultimate exit strategy. It's 12 to 18 months away, but it's not some sort of magic bullet. Once we've got a vaccine developed, you need government plans to ensure that it's distributed, that people at highest risk get it first. So planning is important to a vaccine. It's important to treatment, which is a second type of science science-led exit strategy and treatment that reduces hospital admissions from COVID-19 infections may be available before a vaccine. But again, you've got questions about what government will be doing to increase domestic supply, what it might be doing to procure successful treatments from abroad. So there are questions about planning and treatment. And then in terms of sort of more immediate strategies, it seems to me from reading the evidence that, and I'm sure we'll be hearing more from Aaron about this, that contact tracing and community testing would be really, really key if we're going to relax social distancing once we've got the infection rate down in terms of preventing or stemming future outbreaks. That's really, really key. But again, I think there are huge questions for the government around this. First of all, around testing capacity. I think there's a real lack of concern at the lack of detail we've got about exactly how government intends to meet this 100,000, this target for 100,000 tests by the end of the month, which will need to be higher still if we're using community testing and tracing as an exit strategy. And then also in terms of contact tracing, there seems to be a lot of stall being set by an app, but I'm sure we'll be hearing about the Singaporean experience, but we know from Singapore that an app by itself does not work. There's a lot of sort of warnings from the Singaporean government that it needs to be a people-led contact tracing strategy, partly because people at highest risk don't necessarily have an app on their phones, and also because Bluetooth technology is not that reliable. So I want to hear from government, what exactly are they doing to increase capacity around community testing and tracing, because that's something we might need in 8 weeks' time, and we as citizens, I think, need to know what the government is planning on that. There's also another type of exit strategy which we've heard sort of discussed, which is sort of loosening restrictions for some parts of the economy, or for some sectors like schools, or for people with immunity, or particular age groups, or particular geographies. And I think there will be a whole host of considerations around that. I don't think any of that is necessarily simple. I think there are scientific considerations, for example, around immunity. We've had lots of loose talk about immunity certificates. We don't even know how long immunity lasts. We don't have the tests yet to reliably show whether somebody's got the antibodies. I think in terms of age restrictions and geography, that poses difficult challenges for a society where there's a real kind of collective sort of, there's been a collective response around the lockdown so far, and perhaps social distancing will be harder to do for particular groups if you see other groups going out, or other parts of the country going out. So I'm probably coming to the end of my allotted time, so I will park my comments there. Just a couple more things to say, which is, I think that most people think that we will be living with some form of social distancing for a while to come until there's a vaccine. And it might be a much more relaxed form of social distancing. We might be wearing masks more, but I think given that, it's really important that we have some signals from government about the planning they're doing. And then the final point I would just make is my comments are really focused around the domestic sort of political considerations, but we mustn't sort of shy away from talking about the global politics around this. Any successful exit strategy will be global. This is a global pandemic. There's no point one country acting nationally to sort of stop it, only to see an outbreak in a neighbouring country sort of, or another continent, 4 months later, and for the for that outbreak to bounce back. So we really have to be thinking at the political level about global strategies as well around, for example, the vaccine. How do we ensure equitable access to a vaccine? How do we ensure equitable access to treatments? And I think that is incredibly difficult in a world where you've got an America First president in President Trump just taken the really shocking decision to withdraw funding from the WHO. So how does a country like Britain provide global leadership in these times? It's a very difficult question. There have been some very positive signs from government. So the government has really stepped up in terms of its contribution to the vaccine efforts, in terms of funding. But we probably do need to see more from our government as well in terms of global leadership, given the lack of leadership, total lack of leadership from countries like the US.
Thanks, Sonia. That's great. Now, in the interest of time, I will move straight on to Aaron. And Sonia mentioned there the importance of contact tracing and things like that, which is obviously your baby in a sense. I should also say, by the way, thank you for cutting into your evening. I hope we're not keeping you from your dinner in Singapore, but we're very keen to hear what your experience has been. And I know that Singapore entered a kind of lockdown phase again a week or so ago, and what your view is of the route out of that. Over to you.
Yeah, thanks very much, Ian and your team, for this very kind invitation. It's always a pleasure to be able to share some of these ideas, although, the circumstances now are not the most desirable or the most salubrious. I wanted to cover 4 things, and I wanted to start really with the observation that you made about how multifaceted this challenge is. And it's one that involves so many different interlocking parts in a really complex, quite wicked problem. And I thought it was useful from a public policy perspective to actually explore some of these dimensions and how they actually link up as we think about how we move into this next phase. You've talked about exit strategies, and I think one of the big questions we have to ask is exit from what, right? Because we exit from a lockdown, or we exit from what Singapore has called a circuit breaker period, where we're trying to break the chain of transmission. But we had then moved into a space that is still equally uncertain, equally vague in its overall outcomes. And I think really that this concept of an equilibrium, a new steady state, may be something we all need to abandon, because we are not going to be in steady state for a fairly significant period of time, I think. The 4 things I thought I would just kind of cover are, first of all, the health aspects of the crisis, the communications aspect, which my ministry has been very, very deeply involved in. Dealing with fake news, which is really a subset of communications, but I thought it merited a category all by itself. And then also looking at continuity, right, of life and of business in particular, and how we actually go about doing that. And in each of those, actually, technology plays an interesting part. So I thought that was quite a cool common thread running through these different areas. So on health, first of all, I think in Singapore's case, we started out with a fairly extensive contact tracing and testing system. Right? So the idea was to find where the instances of infections were and be able to test them quickly, isolate them where necessary, and then hopefully through that, minimize the disruption to the wider population. I think what we've done in the past week, as you pointed out, to start with much more stringent social distancing measures, told us that we were entering a new phase, in terms of where exactly this tracing had gone. We'd reached some of the limits of that early strategy, and we wanted to make sure that we ensured some breakage of the chain of transmission by having a combination of distancing, testing, and contact tracing working together. Sonia, you mentioned the app that we put out, right? We being the government, right? And our government technology agency spent a lot of time thinking through how exactly to put out this app that we've called Trace Together. And Trace Together is, of course, only one part of this overall composite strategy. It deals with the contact tracing part, but it doesn't then deal with the next steps of testing and distancing. What's interesting about Trace Together is really that it combines decentralized contact logging, right? The logging of who we've actually all been in contact with very centralized and very human contact tracing processes. The whole idea in the process is that a person registers their mobile number, and that mobile, through Bluetooth technology, then actually records other Trace Together users who are in close proximity with that person. That information is stored on the phone, with scrambled identifiers in order to protect user identities, which we thought was critical given the very real issues around privacy and identity that Andrea mentioned. And the idea is that what would then happen is if a person is contacted by a contact tracer, right, and is known to have been in touch with someone else who'd been infected, then they would be asked to upload their data from their phone to a Ministry of Health centralized server. And the idea is that this server, which has all the same government protections as any other public sector server we use, allow us to be in touch with all the people that they've been in contact with over a given period. Now, we tried to minimize the personal data that's been collected. So it's really just the phone number, which is then stored on this secure server with a random anonymized user ID so that we protect identities as much as possible. But as I think several of you pointed out, particularly Sonia, this alone is not a silver bullet or a panacea, right? What this allows us to do is it allows us to make contact with people, but it assumes, of course, that enough people are going to be on the app. And we've been encouraging use of the app as much as possible. There are always going to be some who will not be part of it, which is why we think it's important to not rely on this as a silver bullet, but just as one part of a composite toolkit. And of course, just because the decentralized contact logging is done doesn't mean that we can actually take away the very significant human element that goes into the actual tracing process, which has involved huge numbers of health practitioners actually calling people and going through their day with them, talking to others who they've been in touch with, and building up a chain of interactions in a very, very complex and detailed way. This has involved augmenting the health care scene as well, because clearly the number of healthcare practitioners who do this have not been sufficient for the numbers that are required. And we've had some people who are doing their compulsory military service who are also part of that process, and other sections of the public service which are involved in less essential work have also been activated to take part in some of this contact tracing work. So what we're hoping is that together, right, contact tracing, distancing, and testing can help us to make a significant dent in the number of cases that we are dealing with. So that's the health aspect. Let me just touch on the other three aspects, which I think are equally key, because in any crisis of this nature, we're dealing not just with a health crisis, but a communications crisis as well. And if we can win that communications battle, then that's actually a key part of the overall stabilization that needs to happen, and the overall behavioral influence and behavioral change that needs to take place in order for the health practices to actually be adopted. And what we found in this case is we need to use a complex range of information dissemination platforms for two reasons. One is to get information out to people so that they know what to do and they know when to actually start embarking on particular measures. But equally importantly, we found that putting out information regularly actually creates points of stability for people to regulate what is otherwise a highly unstable situation and an unstable set of circumstances. So one example is we've started to put out regular WhatsApp messages on a system which now has more than 1 million subscribers. And the idea behind this is to, of course, nudge and shape behavior where possible by telling folks when they need to be socially distancing, where there have been too many people gathering, and how they can actually deal with getting knowledge of where they can go such that they maintain safe distancing. We've actually got apps, for instance, that tell us which parks are particularly crowded at the moment so that people can shape their behavior and go elsewhere if they don't want to be in crowds. But we put out these messages at fairly fixed times, and we try to put one at least out every evening, sometime after dinner or so, that summarizes the number of cases for the day. And that's become, for a lot of people, a point of stability. I've had many friends who've actually said to me, why is the announcement late today? Are there more cases than there have been before? This is my bedtime reading, I've not had it yet. So people want to know, right? And I think that thirst for information is something that we can feed by making sure that these points of stability in information communication are dealt with as well as possible. And of course, the information has to be dealt with in multiple platforms. WhatsApp is just one of them, but we've tried to make sure that there is material that goes out on the government websites, both from the Ministry of Health and the more generic gov.sg website. We've used Facebook and Instagram quite extensively. The traditional press releases have to be used as well, because there are folks who are not digitally accessible, and we want to make sure that they have access to information as well. So we've made sure that our newspapers go out with fairly well signposted ads at the front page, which also help to put out key messages around the wearing of masks, around what to do when someone feels unwell, how they shouldn't be doctor hopping, and actually just help nudge and shape behavior in significant ways. So we've combined, I think, both analog and print, as well as broadcast platforms together with the digital to make sure that the information reaches out to as wide and as broad a range as possible. Let me say a bit about falsehoods as well, because unfortunately in situations like this, there are always some people who have nothing else to do with their time than to create falsehoods that have a significant ability, I think, to foment and catalyze panic. And we want to make sure that we have ways of dealing with those. Sometimes all that we need to do is to clarify that something is going around. But sometimes we find that if a post has gone viral, something like or a particular web platform, then we want to actually use more significant levers than that. And we have a law that we call the Protection Against Online Falsehoods and Manipulation Act that allows us to, when a correction directive is issued to a particular entity, they then have to carry a notice that says that there is false information on their site or on their post. They don't have to remove their old post. We're quite happy for them to leave it there, but they have to point out that the falsehood is actually there, just so that we again help to nudge behavior and ensure that people are aware that there is this slightly nefarious information out there, which we want to make sure that they're all aware about. So that's on the falsehoods front, which we find quite key. And when I read stories of how people have put out falsehoods around 5G towers being the cause of the coronavirus spread, and that's resulted in the burning of these towers. Those are exactly the kinds of instances where we would want to take this kind of falsehood-related action. When we've had falsehood that said that particular areas of Singapore had been shut down, this was in the earlier phases of the crisis, we also put out issues on those falsehoods because we wanted to make sure that those did not foment and incite panic. So I think the falsehoods area is a really quite key aspect. Let me just touch quickly on this fourth area of continuity, because I do think that we want to emphasize, especially for a small, open, and densely populated economy like Singapore's, life cannot really stop, even if we're in this period of what we've called the circuit breaker, what other parts of the world are calling lockdowns. When people stay at home, whether that's from school or from work, we've tried to emphasize that life can carry on. Right? Our Infocom and Media Development Authority has put out a campaign called Stay Home, Go Digital, which actually provides suites of software like Zoom that we're on now, but also other things like WebEx and Skype for Business that have allowed the key aspects of business continuity to be maintained. All of government is pretty much functioning offline at the moment, apart from core essential services that require people to be at in-person meetings. I have not been to the office for more than a week now. That has actually meant my diary is more full rather than less full, because the Skype meetings have happened one after the other. We tend to use Skype for Business for government-related interactions just because of the security settings. And we found that has worked really well. WebEx and Zoom interactions like this one have worked really well too. And we find that that's quite important to emphasize to folks that continuity can happen even before we think about exit strategies, right? Where we are in is one where we can, if we are careful, reframe and actually adapt to life without losing some of its most meaningful aspects. I'll stop there and see if there are any questions or any follow-up areas later on. Thanks again.
Thanks, Aaron. That's really great. And just if I could just ask you very quickly on this, we heard a news story yesterday or a couple of days ago about Google and Apple getting together to sort of make sure there's interoperability, which presumably would help the contact tracing system. So I wondered if you had any thoughts on the value of that for you, but also to what extent is the Singapore government considering compulsion or stronger measures to get people to take up the app? Because since take-up is absolutely critical. Currently, I think you're about 20%. It needs to be higher. Are you considering compulsion?
Yeah, we're at about 20% at the moment. Compulsion's not on the cards at the moment, partly because we've moved into this phase now, as you mentioned, where we're emphasizing the distancing aspects a lot more. And so that's not on the cards for now. But as I mentioned, this is such an evolving and fluid situation that we're trying to respond in very real time to ground sentiments and ground circumstances. So we will have to keep revisiting this, I think, and kind of recalibrating our strategies where necessary.
Great. Okay, let's hand over to Bronwen to give us the last contribution. Bronwen, over to you.
Okay, thanks very much. No, this is fascinating. Let me start with the bunch of things that are really about deep principle. It seems to me that the government has to address in deciding when to lift the lockdown, and these are very difficult things to have a conversation with the public about. And then there's a bunch of practical things which we've begun to talk about regions or how you do the lockdown. Again, that needs to be a conversation. So let me kind of look at those two blocks of things. What do I mean by points of deep principle are things like how many people die from COVID versus people dying of other things, and not just acute illnesses that they might have at the moment that are not being diagnosed or not being treated, but the deaths that may follow from more poverty and so on. And I think, this is a real dilemma. There are some very hard choices in deciding when to lift the lockdown. And they're political choices in the best sense of the word, in that the politicians, not civil servants, need to take these in consultation with the public about saying, look, this is what we think is best for the country. And this is in some sense what the country wants. But you've also got, a debate that's out there already about which generation is hit most by this. Obviously, older people are hit disproportionately hard by this particular illness. Younger people are being hit disproportionately hard by the economic shutdown, and very possibly by the economic catastrophe that is likely to be the result of anything more in the way of a shutdown. And you have got that debate there. It's not full volume at the moment, because I think certainly in Britain, everyone's concern has been very much to see the government get on top of the spread of the disease. But it is definitely out there, and there's a whole sort of phalanx of over 70 columnists, if you like, saying, look, we don't think our generation should be privileged over the chances of younger people, whether that is loss of jobs at the moment or the debt that the country is going to bear into those younger people's future. So that debate is out there as well. You have coming out of this all kinds of also difficult decisions about who pays for this in the end. If you take a big chunk out of GDP, which is really what is happening with this lockdown, it's going to settle somewhere. Is it going to be on debt in the future? Very likely. And then you've got all kinds of constituencies saying, well, look, make landlords pay, or make the banks issue all kinds of loans and that may turn into bad loans. And I think really, again, that is much better done as a government debate and decision than by kind of populist movements saying we don't like landlords, look after rental people. But the fact is, if you hit landlords, then you remove property from the system. And there really, again, is a very difficult set of decisions there. And then we have the one that was flickered through this discussion about using digital technology to monitor the spread in the future versus the kind of liberties that people sometimes feel very strongly about. Perhaps they feel less strongly at the moment against the threat of this disease. But those things are out there. And I think it is hard for governments to put those as great abstractions to the public. On the other hand, those are real choices which the country collectively has to make. And they're the hard choices in this about when to lift up the lockdown. Then you've got the practical measures, and we've been hearing about some of them already. Do you let one region go first? Do you let one age group go back to normal life first? What do you say about face masks, about all kinds of social distancing and so on? Those to me are easier, though the communications can get enormously messy, and the message can very quickly get confused. And I can see why the government is struggling to keep the message very, very tidy at the moment. But those are easier because it's going to be a kind of trial and possibly retreat from that, and trial again and retreat. And that seems to me the kind of thing that that Keir Starmer for the opposition is pushing on at the moment. Look, what are you going to do? What's your plan? Well, there isn't going to be a neat plan. There's going to be a series of, you can't even call it roadmap. It is going to be like a sort of set of dancing steps going forward a few feet, and then possibly allowing for a retreat as we see what the health and epidemiological response to that is. Let me just touch finally on the points that Sonia made. Why are some things hard for the government and other things have gone more straightforwardly? A lot about this is hard. And different countries started off in different positions. Some started off with many more ventilators for historical reasons. I think on the ventilator side, the government has actually moved pretty fast, both in procurement and in encouraging the construction of them, manufacture of them. Moved very fast on the construction of the Nightingale hospitals and so on. Where it's been let down, I think, in its planning is the PPE equipment. Obviously, there were problems in procurement, but then the distribution of that around the country has clearly been one weak point. I think we're going to have to look very hard at whether the failings are in central government, which they may have been, or also in the sheer independence of the NHS and the fact that that doesn't always work well with central government. And there's been a lot of restructuring of the NHS, but actually it's difficult in any organisation, let alone a huge one like that, to get the right number of face masks and gloves to every bit of the country. But that clearly has been a weak link. The testing, I incline to give the government a bit of a break on this one, in that it may have been slow, but the tests do not, in many cases, perform as well as everyone has hoped. I was talking to someone in upstate New York who's saying, well, there's actually quite a bit of testing going on. On the other hand, if you come up negative, the doctors are talking about false negatives north of 30%, which is really not a desperate useful test, and actually can be quite misleadingly dangerous. So I think, the world is trying to find useful tests and then scale those up at the moment, but that is a genuinely difficult area. I think it's going to be the clearest lesson coming out of this, of what we end up with is testing capacity for all kinds of diseases, because I entirely agree with those who argue that that is the only way that you can really manage this. Without that, you've simply got a system of trying to manage the crisis of people's health as they enter hospital. And you really don't have enough tools, and that is, short of a vaccine, that is the best tool going, but we're not quite there. So those are my thoughts.
Thanks, Bronwen. And I should mention that Bronwen's written an excellent blog post on the IFG website, so if you haven't read that, I'd recommend it. And Bronwen, in that post,
the hardest questions about lifting the lockdown.
Yes, and in that post you mention that it's not too. You say it's not too early to start asking these questions of government about how it's going to make these trade-offs in principle.
No, I don't think it is. I can absolutely see why the government wants to keep things super simple and say, stay at home, because that has been very successful, more than the I hope now discredited behavioural scientists would think, because they were very much saying that people aren't going to follow these rules.
So I guess the question I wanted to ask you really about that was, do you fully buy the argument that the motivation for not talking about it is message simplicity, or is there something else going on here, like most of the exit routes we're not very well prepared, and they don't really want too much scrutiny on that until they've got a more positive story to tell, which may be a perfectly legitimate thing to do, but is there something of that in there too?
I wouldn't put it quite like that. I would just say, no, they don't have a plan. At the moment, they are exploring different plans. And the plans there has to be a discussion about the economic impact of that. And I think that is just getting some real force to it at the moment. You've had all kinds of, excuse me, figures, projections and all, projections that aren't projections, but kind of predictions of what this might look like. And really, I mean, just swinging bites taken out of the economic health of the country and economic activity. I think there is a growing realization that if you double the length of the lockdown, you do far more than double the economic damage, because some things will be lost permanently, businesses will go under. I think there's a lot of pressure coming on the access to the economic support that the government has given. So it did move very fast on the economic support, and I think very smartly on that. On the other hand, inevitably, but frustratingly, the access to that, whether through bank loans, whatever, is proving very, very sticky. And you've got another point coming up when we get to the end of May, when the government's support for furloughed employees, the 80% of their pay, that runs out. And there's a question about whether there'll be a huge jump in job losses at that point as companies simply shut down or lay off workers. So I think they've got a lot to plan on the economic front and how long they keep the support going. No, I don't think a plan is going to sound that neat. It's going to come as a series of decisions about partially lifting the lockdown, but the key decisions, I think, are about how quickly you try and do that. And I think the sense of urgency is absolutely there. And those discussions are going on, as they're going on in the country, about how long do you keep going with the lockdown, because the economic damage is enormous. And it may actually be harder than people thought you can't just throw a switch and get back to normal life. It actually may be quite hard to get people out of lockdown again. Some will be desperate to go on with normal life, whether for health or for business reasons, but others may be very, very wary, and it may be quite hard for the government then to encourage people. So no, I think that debate is out there, as well as the stay home simplicity at the moment.
Great, okay, thanks. Right, let's go to some questions then from our audience. Adrian, if I can come to you first, you've got a question about Sweden. I'll take a few questions and then come to the panel to pick up whatever they think is most relevant to them. Adrian, I'll unmute you if you want to ask your question.
Sure, thank you. So I live in Sweden, and the question I'm asked regularly these days is, what's going on in Sweden? Why is the Swedish government adopting a different approach? And I suppose in relation to the exit discussion, is there anything we can learn from what's happening in Sweden where they've not adopted such strict lockdown measures and they haven't seen the exponential growth in cases that you might have expected as a result of that? Is there anything we can learn from what's happening here as to inform the debate about the exit strategy?
Okay, great, thank you. And then if I might also come to Martin, you had a question about different elements of the exit strategy. Do you want to pitch in?
Okay, so my question is, well, without developing the whole case, is there any point in devising any exit strategy that depends on technologies that do not exist or are not known to exist? We've had discussion of things like vaccines and drugs and apps and so on. Those either don't exist or they're not known to work. So is there any point in devising any exit strategy now that depends on such technologies? Seems to me we can only plan to exit with existing technologies, even if they're not perfect. Soap, masks, distancing. There's been no discussion of masks really, and of the impact of masks on transmission. In fact, there's growing evidence of the effectiveness of masks in that regard. And it seems to me that there are two phases to any exit strategy. One is to get the infection rate down, and two is then to eliminate it altogether through contact tracing, and that's a separate phase.
Okay, thanks. And if I could come, Francis, to you, you had a question there. Can you hear us?
I did indeed. Can you hear me?
Yeah.
Yeah, brilliant. Okay, we've been talking about the lockdown now as if this is just one thing that we can sort of discuss ending the lockdown and somehow then everything can get back to normal. But in fact, if you look at how this has panned out, the country was already shutting down before the lockdown was imposed. We had cancellation of big gatherings, but in fact, conferences and things were already being cancelled by their organisers before any measures were introduced. So my question is really about, it's all very well discussing the lockdown and even social distancing measures, but should we be discussing how we exit from the kind of social distancing that we kind of put in place collectively as a society? And if we can't or we don't, what the economic damage is likely to be from continuing those kind of measures really for quite a long time to come.
Okay, thanks, Francis. Okay, let's, who on the panel wants to take that, one of those first? We've got particularly the Sweden example to kick off with. I don't know whether, Andrea, whether you have views on what's going on in Sweden. It is particularly fascinating that they don't appear to have the level of lockdown everywhere else does. Do you have any thoughts on that?
Well, I think they are paying a price for this because they have a lot of infected people and quite a lot of fatalities. And I heard that they are rethinking this. I mean, it's not. They're still under debate whether. But this is a big problem also. I mean, for us, as Sweden is part of the European Community Open Area, and because you need to have a common policy. I mean, it's not a problem for UK, but it will be a huge problem for a European Union because also Netherlands has a different approach. And this, of course, has highlighted the complete lack of a common vision on the side of the European Union. And this has to be addressed sooner or later because it's not acceptable that different countries take different measures, different approach, different metrics to decide when to lift the social distancing, because that will affect their neighborhood. So it's a big issue here, and that need to be addressed.
Yeah. Okay. Does anybody want to take on one of the other questions?
I thought I'd respond. I thought Francis's comment was really interesting and important around kind of what the behavioural response might be if social distancing restrictions get relaxed. And I kind of said before, I think part of the problem here is that this is so unprecedented. There's so little evidence about how the public sort of responds to these sorts of measures and how these sorts of measures might be relaxed. So I don't think we know yet what would happen if the government sort of, you know, in 3 weeks' time said, right, we're relaxing this, and, you know, we're reopening some shops, and you can safely go to, you know, go out for shopping that isn't just food shopping, for example. And so I think the government's going to have to quite closely monitor responses and sort of tailor communications accordingly. But I do think communications will be really key, because I think key to whether people sort of see a relaxing of social distancing and think, right, we can get back to normal in at least some areas of our life, or something. I mean, it will never be normal for a long time yet, but at least something sort of a little bit more towards normal, will be whether they believe that they're safe, and whether they believe what the government tells them in terms of whether it's safe to do so. So again, I think, like, the government's track record on comms has been quite mixed. I think the stay-at-home message has actually been really, really effective, but there have been sort of some mixed messages in the kind of early stages. And so I think I would hope that government is doing a lot of thinking around communications and how it talks to the public in different contingencies. And then the other question I was just going to address was this about existing technologies versus technologies that don't exist yet. And I think it's not an either or. So I think around a vaccine, a really good example of this was, I was talking to the Wellcome Trust last week about global efforts to develop a vaccine. In order to make sure that a vaccine is scalable as quickly as possible, once we've got a vaccine that works, governments are going to have to take risks and invest speculatively in production facilities that may never get used. But when you think about how much money that costs versus how much maybe, you know, the benefits of being able to scale up a vaccine, say in 4 months globally rather than, you know, 3 years globally, you can see why it's really important for governments to sort of take those risks on. So it's not an either or. I think government has to be thinking about what it does around the technologies that we've got available already, but also be developing new technologies, whether that is an app that might be able to be, you know, produced in sort of, you know, 4 weeks to 8 weeks, or a vaccine which might have a timescale of 12 to 18 months.
Okay, great.
Can I just jump in there, Ian? Just to amplify something Sonia just said about the issue of strategies, right? I definitely agree that these are not either or things, and no single strategy can be a silver bullet. I think I mentioned that for panaceas here. We can only be hoping for toolkits that we keep expanding and adding to. So I fully agree that things like washing hands, cleaning surfaces, and doing those things very, very regularly, far more than we were used to before, is going to be key as we combat the public health aspects of this. But sometimes strategies can have both direct and indirect behavioral effects. So for instance, wearing a mask, right? I mean, there is a direct effect that it has in terms of protecting others from me if I'm infectious, protecting me from them if they happen to be infectious. But the act of putting on a mask when one leaves the home is also a bit of a ritual. There is a routine aspect to it that reminds us, I think, to be careful and to undertake more and more careful steps in how we deal with the situations outside of our immediate environments. So I think that's partly why this can't be an either or thing. We need multiple strategies to actually work. Same thing with our app, right? The app works in a technical sense, but every day when I look back and make sure that it's still on, and I make sure that my Bluetooth is on, and I notice that my battery has died far more quickly than before, those are all things that remind me that I have to keep this ever vigilant attitude to this new normal that we're all in. And I think that kind of signaling effect is just as important as the direct, tangible, concrete effects that any aspect of a strategy can have.
Okay, great. Now we're a little bit over time. I'm just going to run on for 2 or 3 more minutes, if that's okay with our panelists. Because I want to get a couple.
Ian, I'm really sorry. I've got to go. It's been a pleasure joining you, but I've got to go.
Okay, thanks, Bronwen. Thanks for joining us.
I can stay for 5 more minutes.
Okay, great. Let me get a couple more questions in. Harvey, you had a question on enforcement and public agreement. Can you?
Yeah, thanks. Can you hear me?
Yeah.
Thank you. Great presentations. Just, my question's really about public consent in a UK context, perhaps to Sonia. As you say, the level of support at the moment is very, very high, but it's pretty fragile and can fall away quite quickly. And I just wondered if you and other colleagues have views on how the government should best secure public consent for ongoing restrictions and enforcement over the next 6 to 12 months. Is that just about more and regular communication? Should they be going further? should they be promoting communications by experts and scientists rather than by politicians? I'd just be interested in, and how important is the reopening of Parliament in that?
James, can you hear us?
So I'm a quick question on contact tracing. So this could be either for Aaron or to Sonia, I suppose. I mean, how plausible is it that the NHS in the UK can very rapidly scale up the kind of huge contact tracing apparatus that seems in many of the plans to be necessary to underpin a phased reduction in social distancing? And maybe Aaron, if you could give us some insight into, compared to, let's say, a month or two ago, how much larger is the Singaporean contact tracing apparatus given what's happened here, given that all of the stuff about the clever technology and Bluetooth apps, I think almost all the commentary seems to suggest that it only really works if you have a very substantial human contact tracing element. So in some of the American plans, you've been talking about hiring tens or hundreds of thousands of people to do this. So.
Okay, great. Thank you, James.
Just thoughts on that would be welcome. Thanks.
Maybe Sonia, if I come to you and then to Aaron, any final words for Andrea, that would be great.
Sure. So two great questions. On Harvey's question about public consent, I think it's all about communications and how the government talks to the public. And I sort of alluded to kind of a bit of a mixed track record by government in my answer to the last question. And what I really meant by that was that I think the stay home message has been really, really effective. But I think earlier on in the response to the crisis, we saw some really some quite dodgy messaging actually from the press conferences. So for example, if you're looking to change public behaviour around, say, buying too much at the supermarket, we had someone from NHS England saying we should all be ashamed of ourselves that there is this nurse who couldn't buy stuff. Now it's awful that the nurse couldn't buy stuff, but also, when you look at what people were doing on an individual level, in many ways it was kind of responsible because the government were saying you might have to quarantine for 2 weeks. So going out and buying 2 weeks worth of food is not an irresponsible thing to do. Obviously, there were some people who were kind of stockpiling beyond that, but you have to think really carefully about what public messages you use and deploy in order to get people to change their behaviour. Telling people they should be ashamed of themselves is not an effective public health messaging tool. So I think it has been a mixed bag, and I actually think it's really interesting, Harvey, that you said it's fragile, because I think some people think that public consent is fragile, but as Francis's question just hinted at, some people think actually public consent for this is so high is that the government are going to give a message out saying, you know, you can do certain things again, and people are going to be reluctant to do it because they've embedded the stay-at-home message. So I think we don't know. We really don't know how the public are going to respond. This is completely and utterly unprecedented, but it is all about comms. And I think the government has got some stuff wrong around that. It's got some stuff right. But what I'm really interested in is, you know, are there strategic comms people? Are these messages getting tested before they go out? Government was really slow off the mark with public information campaigns, for example, on platforms like Facebook. But, you know, you've got someone like Dominic Cummings in government who literally made his name doing A/B testing on Facebook around what messages are effective. So what I really want to know is not actually, you know, is that the messaging isn't a bit ad hoc from people who don't know about messaging and shouldn't be expected to know about messaging because they are scientific experts, not communications experts. I want to know that there is a real concerted effort in government to hone every single message that gets delivered by people, either anonymously or on the record, you know, whether it's on a podium or whether it's on the Today programme or Good Morning Britain. So that's what I'm interested in around public consent. Very quickly, to James's point, I'm not an expert on kind of contact tracing, but we have reported in The Guardian in the last couple of weeks that there were about 300 people in Public Health England doing contact tracing earlier this month. That probably isn't enough. And we've also reported that the government hasn't been using environmental health officers in local authorities. So I think there's a real question, and there are thousands of environmental health officers across the country. So there's a real question about who is deploying what resource here, and you know, Public Health England, are they talking to local authorities and involving them in the public health response, involving them in contact tracing? So I think it can be done, and I'm sure we'll hear from Singapore it can be done. Look at what happened with NHS Nightingale. It can be done, but it requires planning. So I think we need to know more about that.
Okay, Aaron, if I can come to you next, so particularly be keen to hear in terms of the scaling up question for the UK, do you have a sense of how many people are involved in the contact tracing effort in Singapore? Because it sounds like we've got a long way to go. You're on mute.
Sorry about that. There's always one, right, in one of these meetings. I'll be honest, like Sonia, I'm not a contact tracing expert, and I don't know offhand what the total numbers are. I do recall there was a piece in the press in late March saying that we had increased our contact tracing teams from 3 to 20. So that's more than a 6-fold increase just to deal with the load of cases. I need to check on what exactly the number is per team. I'd be happy to, James, to get back to you separately, given that we're both in the same country. And Ian, I could email you some of that detail as well once I find out from my colleagues. But I don't want to speculate because I know it was a significant increase, but I don't know what the exact scale of numbers is.
Great. Okay, well, look, we are very much out of time. I'm sorry that others didn't get to ask questions if they wanted to, but it's been a really fascinating discussion. And I think we've only scratched the surface of such a broad set of issues that we're going to have to deal with if we're going to tackle this virus. And I think we'll be talking about exit strategies and what works and what doesn't for some time to come. So hopefully you'll join us for a future event